Each week, we have an in-depth conversation with individuals involved in the legislative process. This week, we welcome Cassandra Welchlin, who serves as Executive Director of the Mississippi Black Women's Roundtable. Welcome to At Issue.
Thank you for having me.
Okay, so out of the gate, the topic that has really been, I think, the lead of the legislative session, and that's Medicaid expansion, the question of how and who will be covered. As we speak, the Senate is voting on their plan, which is a very much reduced version of the House plan. And so I'll open it this way. As a representative, as the executive director of Black Women's Roundtable, what would expansion look like for you? What have you been asking legislators to consider as this debate continues?
One of the things that we've been asking is the legislature would include the maximum number of people who would benefit from this. And right now we have about 200,000 people who are in that coverage gap. So many people who don't make enough money to, pay for their own, or they, don't, they're not making enough to pay for their own health insurance. And so, or they are not making enough where they will qualify for Medicaid. And so we want those folks to be in there. And so when I think about that, I'm thinking about the faces and the roles of those folks and who they are in our community. And we're talking about the service industry, particularly the restaurant workers, who for us, many of them are Black women who are low-wage workers, but they make a little bit too much to qualify for Medicaid, not enough to pay for their own. We're also talking about childcare workers. We know childcare is so essential to, our state, and we saw that a lot during COVID. However, they don't make enough money, and childcare centers can't pay them what they could be making. I'm also thinking about the hairstylists who take care of us and make us look good, but yet they don't make enough money to just pay for their own insurance. And then the other people I'm thinking about are students. Students who, may not be able to have insurance under their parents because their parents aren't making enough. And so we're left with those folks. And so that is who I am thinking about. And of course, women, right? Black women. So those are the people I'm thinking about, and that's who I want the Mississippi legislature to cover. We're talking about also veterans, construction workers, those folks who really keep, our communities running day to day. And that's who we want the Mississippi legislature to think about, the people who keep our economy running.
Well, with that being said, I mean, the House's plan, it's pretty much a traditional expansion of Medicaid, would cover, really cover that gap of nearly or a little over 200,000 Mississippians. The Senate plan is a much more reduced plan. It doesn't actually fit the qualifications for Medicaid expansion, and the income numbers really don't add many people to the roll. What senators have you been in conversation with, and what has been kind of the temperament of that body as your group tries to push for the things that you just mentioned and push for the people that you've just mentioned?
So it's two sides of the coin, right? We've been talking to Democrats and we've been talking to Republicans in the Senate, and so we know that Democratic senators are really pushing for a real expansion bill. Also one that does no harm, meaning we know that the Senate is going to model a bill or think about modeling a bill that's closer to the Georgia bill,
right,
which requires all of these work requirements. But Mississippi will have the most stringent work requirements of 120 hours. That brings me back to a couple of years ago when the Department of Human Services were trying to implement all of these work requirements for child care, parents who were on the child care subsidy program, and putting all these burdens and barriers in place. this will be the same thing. And what will happen is that you're going to have less people who are going to come on the rolls. When I think about the 120-hour work requirement, first of all, that's going to take a massive amount of money in, Division of Medicaid to they're going to have to hire up. So that's less money that's going to go towards the people who really need it, right? And then they're not going to be able to get all of the federal matching monies. And so we're leaving dollars on the states. And the other part of it is, again, are they going to really be able to manage that? Checking for these work requirements. And then also there has to be this redetermination where people are having to possibly redetermine, more than one time a year. We have been through that, again, with the child care subsidy program and other, programs. It is restrictive. We should not be doing that. So that's one of the things that I'm hearing senators talk about, Democratic senators. On the Republican side, one of the things that, we're hearing is they're trying to just make it work. It may not be the best, but at least we are getting somewhere. Sometimes it's better to do nothing than to put in place a really bad bill. And we know how hard it is. We have fought very hard as advocates, as community folks, to just get us to this place. The House, which has been really amazing, in putting this on the floor and putting a veto-proof bill in place. That's pretty impressive. And so we've come very far, but we know that if a bill goes into effect, it is hard to come back and amend that. And so why not just get it right? We have heard the data. We know the data. We know where Mississippi is. We're talking about a place where Mississippians work. We work, but we are a poor state. And families are just not making enough money. And so covering, up to 138% just gives people, a household that's making $50,000, a household of 4 or 5. Those families, can have a little bit more breathing room where they can use monies for other things to just take care of, their households.
And you mentioned, the idea of like this in the Senate, this idea of, well, let's get something done. And a lot of that comes from pressure from the governor, from the executive, who has campaigned on no Medicaid expansion and has since been lobbying senators for no Medicaid expansion. And you do a lot of work, you mentioned, in the legislature. But I mean, I guess serving the community, so representing the community you represent. How does it feel to have a governor who is against this policy so adamantly, and hasn't really provided his own solution to the healthcare crisis?
It's interesting because, and we said this last year or the year before, when we were pushing to get Medicaid past 12 months postpartum.
Postpartum extension,
exactly.
Yes.
And the conversation came up, and we're living in a post-Roe, right? And I'm sure we'll get to that conversation. And the conservatives and the Republicans and the governor was talking about, we are pro-life. We want life. And abortion is not life. And so one of the things that we said in that was, well, life is across the spectrum. Life is from birth all the way to the end of life. And so much is happening inside of that lifespan, which means that moms and birthing people are having children. And that's life. The same thing. And so they need to not be hypocritical and choose what part of life you want to protect. If you're the governor for all, which is what he said in his State of the State, then that means life from the beginning, life to the end. The same concept applies even now when we're talking about Medicaid expansion or closing the coverage gap, whatever the word you want to use. We know that people in Mississippi are dying. Hospitals are closing. And so you are being very intentional about not providing life-saving health care. And that is life. I'm also very thoughtful right now. We're in the Easter season, or the Passover season, or the resurrection, however you want to call. But we're in a spiritual season here in Mississippi, right? And so, which was all about, life and second chances, right? And so I'm thinking about that even now, that he says that he also is this Christian, right? And well, if I know the God that he says he knows, then that God says that he cares about those who are in need. He cares about those who are may not have the resources that others may have to care for themselves. And so that's about life. So the governor is really being hypocritical and being, I would even say, mean-spirited, in the same sense, because you got to be able to care for all of Mississippians. And that means those 200,000 people who need life-saving care, who are the childcare workers, who are the construction workers, the waitresses, those that serve us, the cashiers that serve us. So I say back, to him, he has to be, you can't be hypocritical. You can't choose which life you want to save. It's all of life.
Yeah. And the idea of protecting life and health of mothers, women, babies, that kind of is a nice little pivot as we think about Mississippi. Mississippi is the state that brought the case before the Supreme Court, Dobbs versus Jackson Women's Health Organization, that saw the overturning of Roe v. Wade. That was in 2021 is when that decision came down. So then the question is then, what is your assessment of what the state has done through the legislature, and I guess, and maybe through some other policy initiatives? What is the assessment of post-Dobbs preserving, protecting, and caring for women and children?
So we've seen, some data even before the session occurred, and that data showed that Mississippi mothers were still dying at a high rate, and particularly, Black moms. We also have seen, more restrictive policies and fights coming down where even with the ballot initiative, this legislative session that was going, dropped, one of the things in there is that that abortion couldn't be a part of the ballot, right? And so our data still shows that women are dying at high rates. And Mississippians, and the thing that I've seen that Mississippi has done is still not enough. You've put more crisis pregnancy centers, in place. However, those crisis pregnancy centers aren't giving, still aren't allowing women to choose, what they want to do with their bodies, because the law has restricted that. And a woman should be able to still, have that choice. The thing that I can say that Mississippi did this legislative session was around, just the maternal health crisis, was around presumptive eligibility. Moms who are pregnant, who can't apply for Medicaid just right away, they've allowed, given them an opportunity to just go to seek medical care because they are presumed eligible. But again, so that's a good thing. Hopefully that would help close the gap, that maternal health care gap. But what I will say, as far as, women being able to have the kinds of family planning that they need, Mississippi is just still very restrictive, in that women are still, afraid to travel. Women who have had miscarriages, doctors and physicians are scared to even give them, the life care, changing care that they would need in the midst of a miscarriage. Like, we've heard those kinds of stories, will this take away my license? And so it puts, again, these additional burdens on physicians and their patient.
And that's a reference to the trigger law that went into
correct,
effect. Okay.
Correct.
Following the Dobbs decision.
Yeah, following the Dobbs decisions. And so we still have a long way to go. Women and birthing people are still, facing tremendous odds, when it comes to, choosing when and how they want to have their children. And also, do I really have the resources? And again, when we're talking about, the wages in the state of Mississippi and women's economic security, wages play a really key part, in that. Again, we are still at $7.25 an hour for minimum wage. We should not be there. Because women have to be able to make, a living wage to take care of their families. In particular, when we're talking about who are heads of households, it is women in the state of Mississippi, and particularly Black women.
Speaking about women and wages and working, and how there's such an intersection between, wage earnings and ability to provide, proper health care for yourself and for your family. March 12th marked Equal Pay Day, and for those who don't follow, Equal Pay Day is the day into the next year that would mark how much longer a woman would have to work to match the salary of a man the previous year, if that's making any sense.
That's correct.
And this has been a huge point of emphasis for you and your organization at the Capitol, at the legislature during these past few sessions. There was an equal pay bill that passed a few sessions ago, but I know a lot of criticism of it that doesn't do enough. So what would you like to see done? How would you like to see that momentum built upon, and what other solutions would you like to offer?
Yeah, we call that the Mississippi Unequal Pay Law. There's nothing equal about it at all. And this past legislative session, we actually worked to get a salary history bill presented before the legislature and or amend the equal pay bill that was passed a couple of years ago. So our bill is the worst law in the country.
And what makes it so?
Because it gives employers actually the right to discriminate based on a couple of factors. One of those factors is salary history. So basically what that means is an employer can ask you what you made in your previous job. Well, and what would happen is that they're going to base your new salary on what you made.
But if you've been underpaid perpetually for years, then it really doesn't do anything to bridge the gap.
It does not. Exactly. It does not. And so that is in our bill, in our law, that employers can, discriminate against you based on your former history. The other thing that I found was interesting was employment gaps. So what that means is if a worker takes off from work for whatever reason, then they can base, your salary or discriminate against you based on how long you have been, how long you have taken off work. We know women, we are caregivers of our families, of our communities. So if we have a baby, or if a loved one gets sick, or if we get sick, there's always going to be a salary, an employment gap for any employee, but particularly for women because we are caregivers. Well, we included that in the bill. That's a problem for all the reasons that I just said. The other thing is wage negotiation skills. How good do you negotiate? Mm-hmm. Well, what does that mean? Well, we know women are stereotyped. We so often are stereotyped because if we go in and try to negotiate, then there's a stereotype around that because men can do it all the time. And there isn't that bias that exists. But when a woman does that, that is not culturally okay that we do it. And oftentimes women don't negotiate because of that. And so all those things are in our law. All of those things are barriers to women getting, better wages and closing the gap. And so for us, we wanted to close the gap and do an amendment in the bill and introduce a new bill, which was around banning employers from asking for salary history. And then the other thing is banning employers from preventing employees from discussing their pay. And oftentimes, that happens in the workforce.
And that's when disparities are kind of discovered amongst
exactly.
individuals. Right?
And oftentimes you don't know that you're not getting paid the same amount that your coworker is getting paid, mostly a man, for doing the same job. So we're still on that trajectory of fighting for that, making sure that we have a better equal pay bill. If Mississippi would have passed a good equal pay bill, including all the things that I just spoke about, then it would cut the poverty rate in half, which means more women also would have, more money to pay for, rent and utilities and childcare and groceries. We're still living in a place of we haven't quite recovered from this pandemic. People are still climbing out of it. And so we need to be able to do everything that we can to make sure every Mississippian, and particularly our women, are getting the wages that they need so they can live and take care of our families. I've always said that, the policy table, the table that these legislators sit at, that we elect them to, those policy tables need to reflect the kitchen tables of their constituents, right? It should look like their tables, the needs of those particular families' kitchen tables. And so I believe that, and we continue to elevate the voices of the kitchen tables to those policy tables and bringing those people there.
All right. We've talked a number of issues, but that's surely not the only issues that you advocate for, both in the community and at the legislature. So I will then kind of just turn the tables here and ask you to just, what are some things that you have top of mind that we haven't discussed about that are high priorities for you and Black Women's Roundtable?
Yeah, voting rights is definitely a high priority for us. Particularly when we're talking about early voting. We know that the Senate was trying to say we need to remove, absentee voting was no longer necessary, but we know that that's not true. Absentee voting and early voting are two different, serve two different purposes and at two different time frames. And so the Senate proposes that if someone comes to register, register with the clerk, they would be allowed, they wouldn't be allowed to turn around and tell them to come back for early voting, right? And so, for us, when we're thinking about, the early voting, we're talking about two different kinds of populations, here. We need early voting. We still need absentee voting. Both of those things are still important. Why choose one over the other? We still need both. I think the other thing, for us is, we're still watching House Bill 1087 around ballot harvesting. And again, House Bill 1406, which is, the absentee, to make sure absentee voting is still intact. So those bills are still very much important around, criminal justice, around the work release programs, because we have a lot of women who are incarcerated. And we want to be able to make sure that those women who are incarcerated are able to keep their wages. And so those work release programs need to be able to, serve those communities. And we know that it reduces recidivism, right? So we've got to just do a better job at making sure we're taking care of all of society. The last thing I will talk about that we've been working on is around the Crown Act. in Mississippi, preventing, discrimination in the workplace and in schools.
And we've seen similar, to explain the Crown Act for this who might not know, because we've seen the Crown Act. Louisiana was successful at passing the Crown
Correct.
Act. Mississippi still has not, even though there has been legislation filed for a number of sessions. But go ahead and elaborate on that.
So the Crown Act is, preventing, again, employers or schools from discriminating against the natural hair of a person. And particularly, we know that mostly that is Black people. And we're talking about natural hair in its natural state. And so we're talking about afros and dreadlocks, and we're talking, about braids. And so the length of them, any of those things, like we want to be able to wear our hair the way we want to wear our hair that is in its natural state. And so it's so interesting that we're having this conversation. About 2 weeks ago, I had a conversation with a worker who came up to me. She knew that we were working on this, and she said, "Are you all working to get the Crown Act passed in Mississippi?" I said, "Yes, we are working with our partners to do that." And she gives me her story. She said, "I came into my job and, I had my afro, and my employer told me that it was not an appropriate hairstyle." And the woman was white who told her that. And she said, "My hair is fine. She said, "Well, it is not fine. You need to have your hair in a different." She said, "Well, how would it?" She said, "Well, it needs to be straightened or something." But that's not her natural style. Right. And so that's hair discrimination, point blank. It's just discriminating against a person based on their hair. And so we need to be able to put protections, in the workplaces, in the schools. We've also had a case up in North Mississippi where a student who was a wrestler, she went to competition, an amazing young woman, Diamond. And Diamond was in competition, and she had braids and beads on her braids. And she was about to start, and they told her, "You have to take these beads out, or you will not be able to compete." So she wanted to compete, but all the team members had to come in there and start taking the beads off quickly. And as a result of that, there's dignity in our hair. And then it is a part of our humanity, too, to be able to live the way we see fit. But they were snatching them out that even her hair began to come out because they were trying to make sure she participated. That's a problem. No one should be violated, in that way. And we've seen these cases all over, even right now in Texas, with the young man who was discriminated against. So that's a real issue of ours. We should be able to go to work and go to school in dignity without having to be harassed about our hair.
All right. Well, Cassandra Welchlin, Executive Director of the Mississippi Black Women's Roundtable, thank you so much for joining us this week on that issue.
Thank you for having me.